Hey everyone, Jen here with Connected Care NP. I just wanted to take a minute to chat today about testosterone replacement therapy. So, most of you probably know testosterone is a hormone. What a lot of people don't realize is that this is a human hormone. Yes, men typically produce significantly more testosterone than women. It is the primary male sex hormone, and their levels are usually much higher than in women, but women also produce testosterone. In fact, women produce more testosterone compared to our other sex hormones like estrogen and progesterone. So, despite testosterone being lower overall in women than men, it's still the most abundant circulating sex hormone in women. It plays a crucial role in various functions for everybody. It helps maintain our bone density, it gives us muscle strength, improve muscle mass, it helps improve mood, it increases libido, it can do a lot of things. It's really the balance between all our hormones that's essential to feeling well. So many people struggling with the symptoms of suboptimal levels are dismissed by traditional healthcare providers, and it has a lot to do with insurance dictating our care. So even if you're fortunate enough to get your levels tested, the results are frequently assessed using normal reference ranges. And these ranges are designed to flag disease, not to identify what is optimal for your vitality and wellness. So at Connected Care NP, we understand that normal isn't always good enough. Our approach to testosterone therapy focuses on achieving those optimal levels and really tailors it to your individual needs. We want to address those root causes. We want to figure out what's causing that fatigue, what's causing that reduced libido and muscle weakness. If it's testosterone, it might be worth looking into and seeing if it's going to help you feel your best. Science shows us that our testosterone levels decline every year past our 30s. So even if it's in that normal range, that doesn't mean it's where it needs to be, where you felt amazing when you were a teenager. So if you have any more questions, comment below. Or of course, you can always reach out and schedule. We're still offering those free consultations. Hope to see everyone soon. Thank you.